What is diabetes? Diabetes is a serious chronic condition of an organism where the blood glucose level is too high. We distinguish two main types of diabetes, type 1 and type 2, and a few rare types of this disease. Based on a report by World Health Organization, the number of patients with diabetes quadrupled from 1980 till 2016. In the world, there are more than 422 million people with diabetes, over 60 million in Europe, and a very large number of those who have all the predisposition to soon get sick of this bummer disease. In Serbia, from the total population, 8.7% of men and 8.5% of women populations are officially ill with diabetes. The estimation is that 3,400,000 deaths are directly related to diabetes annually, and the mortality rate is particularly pronounced in the weaker and medium developed countries. The World Health Organization estimates that the percentage of mortality from this disease could be doubled by 2030. OMEGON AG, a digital healthcare company, was founded in May 2015 with a headquarters in Steinhausen in the canton of Zug in Switzerland, with the goal to ease the life of people suffering from diabetes and contribute to curing and preventing the onset of diabetes in the world. In addition to diabetes, OMEGON also works on projects relating to the care of people with cardiovascular diseases, oncological diseases, and people suffering from multiple sclerosis and depression. OMEGON's founder, executive, and at the same time technical director is Mr. Sebastian Hecht, a person with more than 20 years of experience in private entrepreneurship, out of which 14 years as being executive director in various companies. Co-owner and director of scientific research, Dr. Martin Miller-Wolf, a man with more than 28 years of experience in healthcare, a humanist and founder of the We Care Foundation, winner of numerous awards for humanitarian and health projects by the United Nations. The world-renowned doctor of psychology who speaks 18 languages, is the investor and owner of the patient for the world's first diabetes management system, INDIMA system. The absolute right to distribution and use was purchased by OMEGON AG Switzerland. What is INDIMA? INDIMA is short term for Individual Diabetes Management. INDIMA is our response in line with the development of technology and technological innovations in healthcare for the growing problem of diabetes. INDIMA aims to provide direct communications between a physician who treats and the patient himself. As a result of this direct contact with the doctor through the application, patients are encouraged to deal proactively and consciously with their illness, in this case diabetes, initiate measures for the treatment of symptoms that, based on analysis of their own condition, will receive in the form of messages through the application itself. The goal of INDIMA application is to create a system of action and support program so that the patient can better manage their illness and thus enjoy a better quality of life. This system is complemented by innovations in the four leading fields in the field of healthcare: medicine, psychomedicine, IT and physics, where the innovative INDIMA belt, which is connected via Bluetooth to the INDIMA system, has been declared as being the best sensor of activity and detection of the world's movement according to a Harvard study. You can find out more details regarding the INDIMA application on our website. Quantum magnetic resonance analyzers means high technology of innovative medicine, bioinformatics, quantum physics and information technologies. Quantum medicine, at the level of the theory, is an advanced electronic technology that detects the weak magnetic fields of our body and provides an analysis with information of the overall state of health of the person, including possible problems. In this way, we can get preventive information about the health status of the person being analyzed. The method is absolutely painless and there are no contraindications, so it can be used by all people regardless of age. The quantum resonant magnetic analysis method is fast and accurate and represents a non-invasive spectral testing method that is suitable for comparing and analyzing the effects of drugs and medical products. There are over 30 items whose results are obtained during examination, including cardiovascular and cerebral vascular analysis, bone mineral density, mineral and vitamin composition, heavy metal concentration, rheumatism, lungs and respiratory tract, neuropathy, blood sugar, stomach and intestines, liver and bile, nerves, gynecology. The results of the analysis are sent to the INDIMA team of doctors, thus completes the picture of the patient general condition, which contributes to a better and more detailed approach to each patient separately and prevention of possible complications. There is no doubt that the advanced technologies and an innovative approach to the treatment of the disease will contribute to their better lives of the diseased and considerably reduce the cost of traditional treatment, which are being drastically increased each year. The cost of insulin-treated diabetes has risen 200 times for the past 10 years. The volume of pharmaceutical drug trade for the prevention and treatment of diabetes in the year 2017 alone was about $55 billion US. The question arises as to whether there will be enough physicians to consult each patient to a sufficient extent in order to access the treatment of the cause of the disease in the best possible way. We are witnessing that we are living in the age of technological development. The OMEGON AG, a digital healthcare company, has initiated its original cryptocurrency called the OMEGON token, which is expected to emerge on the stock of exchange on January 1st, 2019, when it will be exchanged in a ratio of 1:1 to OMEGON coin, with an expected value of at least €1 per 1 OMEGON coin. INDIMA application, a revolutionary way to fight against the diabetes, which is fully owned by OMEGON AG, for whose usage after the test phase will be able to play exclusively with OMEGON coin, as well as for quantum magnetic analyzer checks. For weekly medical treatments at the specialized diabetics clinics around the world, where OMEGON coin will be used as a means of payment, the promotion of usage of the INDIMA application will be promoted, and further education of the patients in order to understand all the benefits of it. A unique currency for all 420 million people who have diabetes issued. In the initial token offer phase, for OMEGON project supporters, the OMEGON token is purchased for a price of €0.15, but at the end of June 2018, during the promotional period, 4 times more tokens are received. During the promotion in July, the number of purchased tokens obtained is multiplied by 3.5. For example, the price of the analysis with the quantum magnetic analyzer apparatus costs €50, which will be equal to 50 OMEGON coins starting from 1st of January 2019, with a minimum coin value of €1. By purchasing a token in the promotional period in the month of June, a saving on 26.6 times is made in relation to the money invested, and in reality, this check will cost less than €2 of invested money. In August, the saving of 20 times compared to the investment are realized, so that the review actually costs €2.5 for the investor. In October, when the number of purchased tokens is multiplied by 2, savings would be 13.3 times in relation to the investment, so the analysis would actually cost €3.76 of the invested money. In December, when the number of tokens is multiplied by 1, the saving of 6.6 times in relation to the investment are achieved, so the analysis will actually cost €7.5. A similar example can also be shown with comparing the cost of treatment at the specialized diabetes facilities, where for 7 days with a full board and complete medical examination costs, for an example, approximately €500, which should be paid with 500 OMEGON coins starting from January 2019, in the minimum value of 1 OMEGON coin is €1, as it is expected. The investor who made the decision to support the project in June actually cost €18.8 in reality compared to the invested money amount. Monthly fee for the INDIMA application that will also be charged exclusively by OMEGON coins, where early investors and project supporters purchasing token will cost 26 times less comparing in January, when for 1 OMEGON coin that will be able to buy at the stock exchange at a price from minimum €1 for a coin, or at a price that will be actual on the stock market because of the supply and demand on a global level. €1 per 1 coin is the minimum expected price of OMEGON coin until being listed on the stock market, but the upper limit cannot be determined or limited and will depend on supply and demand. It is important that you understand that with the support of project you will get on your OMEGON wallet on the Ethereum platform the equivalent number of tokens according to the promotional period in which you decided to support the project. Moreover, in supporting our project, you act on your own behalf, not on behalf of another person or a company.
Thank you for your attention and thank you very much for supporting our project. Clever Studio.